Okay. So the central venous pressure is the next concept that we'll be discussing in orthopedics. Central venous pressure, the CVP. Okay. So central venous pressure is just known as a key hemodynamic measurement. So it reflects the pressure in the thoracic vena cava, right, near the right atrium. So we are just trying to measure a pressure, So it's essentially a snapshot of how much blood is returning to the heart, all right, and how well the heart is handling that load. Do you understand? If I'm able to pick up the pressure, from this big vein, I will know how much blood is returning to the heart, So why do we do this? What does it tell you? Venous return indicates how much blood is flowing back to the heart. Right atrial pressure, all right. You can also know, fluid status helps to determine if the patient has a low, fluid in the body, or the fluid is normal, or the fluid is too much. Cardiac function, it will help you to now know that whether your right ventricle is functioning properly or not. All right. So these are the normal values. So anything 2 to 6 millimeter mercury is normal, right? Less than 2 shows that the patient doesn't have a lot of fluid in the body, right? This might now trigger you to start doing all those fluid replacement. Then more than 8, right, indicate that there's fluid overload, maybe heart failure, edema, and all of that. So clinical uses, it can guide fluid therapy whether a patient needs fluid replacement or not. All right. Then if the fluid is too much, you might now want to give drugs that will help the patient put out the fluid, like diuretics and all of that. You can help dictate complications like cardiac tamponade or tension pneumothorax. Evaluate if the patient is in shock of the circulatory failure. All right. So how is it measured? Via a central venous catheter placed in the subclavian jugular femoral vein. Okay, so this is central catheter that we have been saying. So that's what you use. So measured at end-expiration to avoid respiration pressure fluctuations. Okay, so that's just what the central venous pressure entails in patient management.